Jenlink. I'm a DMP student with UMass Amherst. We're going to be covering Case Study 5 today. Did you have any trouble finding my office?
No.
Okay. And when we spoke, I gave you my contact info in my office hours, so you know how to get in touch with me if you need me. Okay. And you filled out the HIPAA form?
Mm-hmm.
Do you have any questions about that, about privacy?
No.
Okay. I should tell you that everything you say is confidential unless there's any concern about harm to yourself or the public. I may have to report it just if there's potential for harm. Or domestic violence, abuse, or neglect of children. There's a list of things that I can talk to you about if you have any questions.
Okay.
So let's talk about you. What brings you in today?
I've been feeling a little depressed lately, a little anxious and stuff like that, but mostly it's my family and my boyfriend have really been saying that I'm getting too thin and that I'm kind of acting more depressed than I should and everything like that, and so we've been arguing about it, and I just thought I should come in and talk to someone so that I can kind of get them to be quiet about it.
Okay, so you're kind of coming in to appease them.
Yeah.
Okay.
Yeah.
All right. So you're 20 years old?
Yeah.
What do you do for work?
I'm a model.
Okay, so modeling and weight loss kind of go hand in hand.
Yeah.
Do you need to lose weight?
Well, I think I need to lose weight, but about 4 months ago, my agent told me that I was getting too fat and that I would lose my biggest client if I didn't lose some weight. So I've just been cutting out eating a lot and just getting rid of all that sort of stuff so that I can keep this client because I really love working with them.
Oh, okay. And you said that was about 4 months ago that?
Yeah.
And you've lost weight since?
Yeah.
You have?
Yeah.
How much do you weigh now, if you don't mind asking?
I'm about 120.
Okay, and what's your height?
5'9".
Okay. I'm going to look that up on my BMI index and see. Okay, so that actually says if you're 5'9" and how much again?
120.
120, yeah. That says that you're actually underweight.
Really?
So, yeah, so maybe we should talk a little bit about that. You are restricting your diet significantly?
Yeah, I've been keeping track of what I eat and everything like that so I make sure I lose weight.
Okay. And definitely concerned about losing weight. That's your primary concern?
Yeah, I need to lose a little bit more weight.
Okay, and you mentioned anxiety and depression as well?
Yeah, well, it's just, I feel like I'm getting just worried about losing this job and just feeling anxious about what happens if I did lose it and trying to get other jobs and making sure I'm in the right weight for this career and all that sort of stuff. So it's just, I've just been feeling normally stressed, I would say, about things about work.
Okay. And I had you fill out those assessments before you came in, and I had a chance to score them. So on the cross-cutting symptom, the first one that had all the questions, it showed that there are 2 categories that you kind of scored a little high on. Those categories are anxiety and depression. And so I went to the level 2. It's kind of the secondary one. Those were the smaller forms that you did. And they showed, after your answers, they showed that you do have moderate anxiety and depression, which also, that I had you do a lot of homework, sorry. The other form, the HUDAS, that had a whole host of questions as well that talked about kind of your daily functioning.
Yeah.
That showed that you were having mild to moderate difficulty in your daily life.
Yeah.
Because of your depression and anxiety. So, it sounds like you don't really feel like it's too much of a problem, but these questions kind of show that maybe there's a little bit more going on.
Okay.
How do you feel about that?
I mean, I guess I could see it, but I just feel like it kind of comes with the job and that sort of thing.
That's true, modeling and your appearance, that's kind of the primary focus, isn't it? So we'll switch gears just for a minute to your medical history. And have you ever had any diagnosis of depression or anxiety, anything like this before?
No.
No, and no counseling before?
Mm-mm.
Okay. Have you ever felt suicidal or
No.
Okay. And do you feel suicidal at this point?
No.
Okay. You don't feel like harming yourself?
No.
Do you take any medications?
No, I just take some vitamins, stuff like that.
Okay.
I take Dexatrim as well. I don't know if that's...
Oh, the weight loss?
Yeah.
Okay.
Yeah.
How often do you take that?
Well, I used to just take it every once in a while, but now I take it like what it says on the bottle, so I take it just more frequently.
Daily?
Yeah.
Okay. All right. I guess while we're talking about medications, do you take any caffeine or do you smoke, anything like
I
that?
drink a lot of coffee.
A lot of coffee?
Yeah.
How much is a lot?
A few cups a day, like 3, 4.
3 or 4. Okay. Any drug use?
No.
Okay. And then how about your family? Does your family have any history of any kind of depression or anxiety or suicide?
My mom's side of the family does.
Okay. What kind of?
I know my grandmother has depression, and I know my mom used to have a lot of depression problems.
Okay. Did they see counselors for it?
Yeah.
Did they go on medication for it?
Mm-hmm.
They did.
Yeah.
Okay. But you said that that was in the past. Do they don't anymore?
I don't know if she does anymore. She might.
Okay. Well, speaking of your family, did you grow up around here?
We kind of moved around a lot.
Okay. Why did you move?
My dad's job.
Okay. Was he in the military?
No, he's actually an engineer.
An engineer. Okay. And what did your mom do?
She's a stay-at-home mom.
Okay. And how was that, the moving around?
It was fine for the most part.
Okay. Did it cause a lot of difficulty with school or anything?
When I was maybe in middle school, but then through my high school we were like at the same school, so it was fine.
Oh, okay, so you were able to stay
locally.
Okay. How was your relationship with your parents when you were growing up?
It was really good when I was growing up. We got along really good.
Okay, and how would you say it is now?
It's just stressful because they're always worried about my weight or how I'm acting, if I'm sleeping too much, so like I try to avoid seeing them as much lately because we fight a lot.
Okay, and when you say they're worried about your weight, what kind of worry are they?
They just say I'm too thin.
Too thin?
Yeah.
You're losing too much weight?
Yeah.
Okay. Do you have any siblings?
Yeah, I have a sister.
A sister? And how's your relationship with her?
It's good. I don't see her as much lately just because she lives further away from me, but yeah, we have a good relationship.
Okay. Is she supportive about your career?
Yeah, I mean, I don't see her as much and I don't talk to her as much, but yeah, she is.
She is. Have you seen her recently in the last 4 months since?
No.
Okay. And then how about friends? Do you have
Yeah, I have a
friends?
couple of good friends.
Okay. And are they in the modeling world as well? Okay. So do they have issues with their weight as well?
Yeah, we're always kind of competing with one another and like sharing diet secrets and meals and stuff like that. So,
okay.
Yeah.
And then are you in any relationships?
Yeah, I have a boyfriend.
A boyfriend? Do you live together?
Yeah.
You do?
Mm-hmm.
How long have you been living together?
About a year.
And is that going okay?
Yeah.
And is he supportive of your career as well?
But he's worried about the losing weight stuff, says it's going a little bit too far, is worried about all that sort of stuff and my headaches and stuff like that. So, but otherwise, it's a good relationship.
Okay. And any history of abuse or anybody ever do anything?
No.
As a teenager, how were you in school and
I did really good in school.
Yeah. Good grades?
Mm-hmm.
Well adjusted?
Yeah.
Did you work? Did you have activities to do?
I was mostly in sports.
Sports. Did you ever get in trouble?
Occasional detentions in school or grounded every once in a while, but nothing big.
And did you have jobs when you were in school?
Yeah, in the summers I would.
Okay. And how'd you do in those jobs? Did you get along okay with everybody?
Yeah.
And During your teen years, how were your relationships with your parents?
It was good. Besides, like, just normal kid stuff, worrying, talking about grades and all that sort of thing, but I didn't have a problem with them.
And how was their discipline style?
I always thought it was strict. I had a really early curfew, but
How early was the curfew?
I don't know, like 11.
Okay. And say you broke that curfew, what would happen?
I'd be grounded.
Grounded for how long?
Probably the next weekend.
Okay. And how did you feel about that at the time?
It sucked because if I was a couple minutes late, they would crack down on me. But
Okay, so they weren't lenient at all.
no.
Do you feel like it was fair?
I mean, I guess looking back on it now, but at the time I hated it.
Okay. But do you feel like it kind of affected your relationship with them?
I mean, we would get in fights because I didn't want to be grounded, but it was fine.
Okay. You weren't trying to run away or anything?
No.
Okay. And then now you've graduated high school. Did you go to college?
Mm-mm.
Okay. So you started working as a model right away?
Yeah, my last year of high school was when I first started.
Okay. And is that your your primary source
Yeah.
of work? Okay. And I guess I didn't ask. Are you living with your parents?
No,
You said your boyfriend.
Yeah.
Okay. An apartment?
Yep.
Okay. How are you doing with paying the bills and?
Oh, my job is really, I mean, the clients I get to work with, I get paid really well, so financially I'm set right now.
Okay, so it's going pretty well.
Mm-hmm.
As long as you, as long as your manager is happy with your appearance.
Yeah.
Okay, so that's kind of the source of the stress.
Yeah.
Making sure you keep this job.
Yeah.
Okay. Do you enjoy it? Do you enjoy your work?
Yeah, I love it.
You do. Even with the requirements of.
Yeah, I mean, I totally see where she's coming from, and, a lot of the girls that I work with, they're all in great shape, so I see, just kind of maintaining where I'm at, and I'm getting a little older for the modeling industry, so.
Okay. How old is old in the modeling industry?
Usually about, like, 25, I would say. That's when girls are kind of, like, starting to get near the end.
Okay. What do you think you're going to do when you start getting that age? Do you have any goals?
I'm hoping to become, like, either a representative for some skincare line or something like that, so that I can kind of continue doing it but not runway modeling.
Okay. So staying in the modeling.
Yeah.
Okay. What else did I have? So you said that these issues that you've been having, about 4 months ago, your manager said that she felt like you needed to lose some weight. Did you have the anxiety and the depression issues before that?
Not really, no.
You're pretty happy and
Yeah.
doing okay?
Yeah.
Okay. So pretty much all of these symptoms that you're experiencing now are just from that one time that she said
Yeah.
you need to lose weight. And have you gotten feedback from her about?
Oh, yeah, she says I'm on a good path, but she said I still need to lose more weight. Yeah.
Okay. And you've said a couple of times that you feel like you do agree with her that you have more.
Yeah.
Okay.
Definitely.
So when you look in the mirror, you don't see.
No,
that you're
I definitely see, like, spots where I could lose some weight, for sure.
Okay. So with this weight loss, how are you feeling, like physically?
I mean, I feel like obviously I'm not getting as many calories, so I know that, that's part of the weight loss thing where you just feel more headachy and more tired and that sort of thing. So I definitely see that, but I think it's fine. I think it's fine. It's just part of the job.
So you said headaches.
Mm-hmm.
How about your stomach, GI system? How are you feeling?
I've had some diarrhea.
Diarrhea.
Yeah.
Okay. Would you say it's constant?
I'd say sometimes like 2 times a day. Sometimes.
Okay. And do you have any other illnesses or any illnesses that you've been treated for?
No,
No.
I had my appendix out.
Okay, so you had one surgery so far?
Yeah.
Okay. Have you ever been in the hospital other than that time?
No.
Okay. Have you ever hit your head? Or you said you did sports in high school.
No.
No, you never lost consciousness.
No.
Okay. Did I ask you about alcohol use? Yeah, you said just a little bit, I think.
Yeah, I do just like on the weekends occasionally.
Okay. And when you do drink the alcohol on the weekends, do you do moderation a lot? How much do you do?
I have like between 6 and 10 beers a night or something.
Okay, so you get a little.
Yeah.
Okay. And how is that for you when you drink a lot?
It's fine. I just sometimes I wake up a little bit more headachy in the morning. But.
Okay. And I have to ask with alcohol, it does have some calories. Is that okay with you?
I usually will just really not eat a whole lot earlier. If I plan on going out with everyone and drinking or something, I really just only have like a small breakfast or something like that.
Okay. Do you count how many calories you eat per day?
Yeah.
You do, and so you have kind of a tally.
Yeah, I have an app on my phone that I can keep track of all the calories.
Okay. And so that kind of keeps you in check for
day to
day. Okay. So you mentioned headaches. Do you have any difficulty breathing? Any
No.
Any numbness or tingling in your fingers ever?
No.
Do you ever find it kind of hard to walk? Do you get dizzy when you stand up?
Sometimes, yeah. I'll get a little bit dizzy, just like lightheaded, but...
Lightheaded, okay. Do you think that could be something wrong with you, or
it's probably
not too worried?
Sometimes if I, like, towards the end of the day, if I just haven't eaten a whole lot or something, sometimes I feel like that. But...
Okay, so you think it might be because of not eating quite enough?
Yeah.
Okay. How's your skin?
It's good. It's fine.
Okay. I only ask because sometimes if you're kind of counting calories, you might have some dry skin. Just seeing how you're doing nutrition-wise. Have you ever seen a nutritionist?
No. Like when I first started, I saw someone, but I haven't in a couple of years.
And what kind of stuff did you work with them?
Just kind of setting goal calories and like making sure I had rounded meals and eating fruits and vegetables and stuff.
Okay. Do you do that now? Do you still kind of follow that?
No, just because I'm cutting back, so.
Okay. What kind of foods do you eat during the day?
Like for breakfast, I'll have usually about 5 crackers, and then I drink a ton of water so I can stay hydrated. I'll have coffee and stuff like that. I usually skip lunch. A lot of times I'm working, so it's fine. And for dinner, I'll have like a salad without any dressing or anything like that. Just maybe like a couple of tomatoes. So just mostly lettuce and tomatoes and stuff like that.
Okay, so definitely not a whole lot of food.
No.
You're not going out for pizzas.
No, that'll be like a really, really, really rare thing.
Okay. All right, let's switch gears a little bit, and I just want to do a little check of your memory and see how your mental status is doing.
Okay.
So let's start with what year is it right now?
It's 2016.
Okay, and the season?
It's winter. Well, spring, I guess, technically.
It is. The weather has been a little bit difficult. Do you know the day of the week?
It's Wednesday.
And how about the actual date?
It is the 6th of April.
Okay. And do you know where you are right now?
Your medical office.
Okay. And what city is this?
Newmarket.
And the state?
New Hampshire.
Okay. So I'm going to give you 3 items that I'd like you to remember.
Okay.
And then we'll talk about a couple other things, and I'll see if you remember them afterwards.
Okay.
So those 3 objects are a table, a pen, and a shoe.
Okay.
Can you say those back?
Table, pen, and shoe.
Okay. Then let's go to a math question. What is 2 times 384?
768.
Okay, that's great. Do you know who the president is right now?
Obama?
And who was before him?
Bush?
And then before him?
Clinton?
Okay. What was the date? Do you have an anniversary for your getting together with your boyfriend?
August 11th of 2014.
Okay. And so here's a little scenario. What would you do with this? If you were walking down the sidewalk and you found an addressed stamped envelope on the sidewalk, what would you do?
Put it in like a mailbox.
Yeah, you'd mail it?
Yeah.
Okay, great. And if I give you this paper, could you write or draw a clock on it with the hands pointing to 11:25?
Sure. And you said what time?
11:25. Great. And then, actually, I'll give this back to you. Can you write a sentence, just anything you want to say? Okay, great. All right. So those were all great answers. Your mental status seems to be just great, functioning very well. So I wanted to talk a little bit, go back to some of your symptoms. You, like I said, you scored moderate on anxiety and depression, as well as having some symptoms of anorexia is actually what a lot of the things you're talking about with your concern about your looks and your weight and the restrictions of your diet. You actually kind of fit the diagnostic criteria for anorexia. So let's talk about that for a minute. How do you feel about that kind of a diagnosis?
I mean, maybe technically I do, but I feel like in this industry it's different. It's a just different set of criteria. So, I mean, I don't know. So,
like, it sounds to me like you're saying my book might say that you're anorexic, but because of what you do for work, it's kind of a normal thing in your world.
Yeah.
Okay, so you're not really concerned about being diagnosed like that.
I mean, I don't think I am. So, and obviously my agent doesn't either.
Right.
So.
And your friends, you said, are very similar.
Yeah.
Okay. So it doesn't concern you too much, but you know that your family is concerned about it.
Yeah, I know they're worried about it.
Okay. Does that play a part in how you feel about what you're doing, or?
I mean, it does, because I don't want them to be worried about me.
Okay. But it's not going to change what you're doing.
I don't know.
Okay. And then we'll kind of review a couple of your answers here for, let's start with the anxiety part.
Okay.
You clicked on feeling nervous and anxious and frightened and worried, kind of on the edge. Mm-hmm. What's that kind of related to?
Just worried about losing the job and everything. I don't want to lose it.
Okay. And you scored pretty high with feeling anxious and worried, and so that's still about the job and not losing your job. And then uneasy and tense. You scored pretty high for that too.
Yeah, I just feel like I'm always worried about what people are going to say or what my family's going to say. So if I know I'm going to see them, I'm worried about that. And then I'm worried about what my agent's going to say, or if I'm on the set for something, if people are looking at me like I look a little fat or something like that. So. Okay,
so you're kind of anxious about your job and family issues, or what other people are going to say about you.
Yeah.
Okay. And where did I put your other? And then with the depression, you you said that you feel nervous, anxious, worried. Oh, we just went over that one. Sorry. Little interest in doing the things that you kind of used to do. Is that maybe towards your family? Is that what?
Yeah, I haven't been seeing them as much and wanting to like go to holiday stuff. And then just not really wanting to go out with other friends as much, like people who aren't models, because we're going out to dinner and stuff like that. So
you kind of avoid those normal interactions where it's food related.
Yeah.
Okay. Do you miss that, going out to
I miss
eat?
my friends. Yeah.
Okay. Have you thought about trying to come up with things that maybe you all could do without food?
Yeah, it's just usually that's what they like to do. So sometimes we do, and that's usually if I go out drinking, that's what we end up doing or something like that.
That's the group that you go out drinking.
Mm-hmm.
Okay. And then you also scored pretty high on feeling down and depressed and hopeless.
Yeah. I feel bad about being fat, so I just feel like I've got to lose weight. Like I feel like I'm not losing it fast enough, so I just feel like I should be doing better. So.
Okay. And that with the expanded level 2 questions, there was one that says, I felt like a failure, and you actually clicked on always number 5 for that one.
Yeah.
You feel like you're kind of failing at this?
Yeah, I just feel like I used to do so well and get a lot of jobs, and this is a really good one. So if I lose it, then that's just it.
Okay. And that you also scored pretty high with, I felt unhappy. Is that kind of, this is affecting your happiness?
Yeah.
Okay. Do you see a way to make things better, like a way to make this?
I think once I get to my target weight, then everything will be so much better.
Okay. What's your target weight?
I am gonna try to get down to about like a 110.
Okay. You think 110 would be kind of where your manager is looking for you to be?
Yeah.
Okay. And you're at 120, so that's 10 pounds.
Yeah.
Okay. And do you have a kind of a timeline that you're trying to get?
In a couple of months, I would say like in a month at tops.
A month at tops. Okay. Have you been exercising too?
Yeah, I exercise a lot.
You do?
Mm-hmm.
Okay. So you're exercising and cutting back on food and hoping to get 10 more pounds off.
Yeah.
And you think you'd be happy at that point? And
I think everything would be great.
Because then you'd be keeping your job. And
Yeah.
Okay.
I think then my parents would understand too. Once they saw that I was keeping my job and everything was fine.
Right. If you were excelling in your job, you feel like that might validate.
Yeah.
Okay. What if it didn't? What if you got to that weight and it still didn't change?
I don't see that happening.
No? Okay. All right. And okay. I think it sounds like my diagnosis for you is anorexia, but you also have some significant depression and anxiety related to these issues. Would you like to come in and talk to me a little bit more about that?
Yeah, I guess I could. I mean, I guess maybe a couple of meetings or something.
Okay, it's not something that you would really want to do, but maybe to
I mean, I
make
do
your
it for
family,
my parents.
for your family. Okay, well, if it's okay with you, I'd like to set up a time next week to talk and see if maybe we can even come to a happy medium where you could feel better about how things are going.
Okay.
And maybe your family can kind of come to some terms as well, so you can all come together.
Yeah.
Would that be good?
Yeah.
Okay. All right, then. So we'll get out our planners and schedule a time for next week.
Okay.
Do you have any questions?
No.
Okay. All right, well, it was great to meet you, and I look forward to seeing you next week.
Great, thanks.
All right, thanks.